Hey guys, welcome to your crash course on ACE inhibitor drugs. By the end of this video, you will know method of action, indications for use, contraindications, pharmacokinetics, patient education and teaching, side effects, and nursing considerations. So what makes ACE inhibitors so special? All ACE inhibitor drugs end in pril. Captopril, lisinopril, enalapril, and fosinapril are just a few examples of these ACE inhibitor drugs that end in pril. How does an ACE inhibitor achieve its therapeutic effect? Well, ACE inhibitors achieve a therapeutic effect by suppressing the renin angiotensin aldosterone system, also known as the RAS. For those of us who might need a little refresher, the RAS system includes the kidneys sensing a drop in blood pressure or blood volume and starting the secretion of renin, which then converts angiotensinogen to angiotensin 1. Angiotensin converting enzyme, also known as ACE, comes and converts angiotensin 1 to angiotensin 2. Angiotensin 2 then causes vasoconstriction and tells the adrenal cortex to secrete more aldosterone, which promotes sodium reabsorption and water in the kidneys. By doing this, there is an increase in blood pressure and blood volume. Now, when administered an ACE inhibitor is going to stop angiotensin converting enzyme, ACE, from converting angiotensin 1 to angiotensin 2. By doing this, it promotes vasodilation and the excretion of sodium and water through the kidneys, resulting in a lowering of blood pressure. Because of this lowering blood pressure effect, patients with history of hypertension, heart failure, and myocardial infarction are commonly prescribed ACE inhibitors. Other uses for ACE inhibitors include patients at risk for stroke and myocardial infarction and patients with diabetic neuropathy. Those are the patients that can use ACE inhibitors, but there are also patients that cannot use ACE inhibitors. ACE inhibitors are contraindicated in patients with renal failure, renal artery stenosis, hypersensitivity, angioedema, in pregnant women, or breastfeeding women. Pharmacokinetics. What the body does to the drug. ACE inhibitors get absorbed in the small intestine, get distributed by the blood in the blood vessels, metabolized by the liver, and excreted through the kidneys and in breast milk. Normal dosages for adults with hypertension range from 2 milligrams to 80 milligrams a day. For heart failure and myocardial infarction, range from 4 milligrams to 100 milligrams a day. And for patients with diabetic neuropathy, they can use captopril at a dosage of 25 milligrams 3 times a day. Factors that shape dose adjustments include patients with renal impairment who should have reduced dosages, and initial dosages for ACE inhibitors should always be low to minimize hypotensive effects. Patient teaching and education. As a nurse, we would want to teach our patient about side effects associated with our medication. With ACE inhibitors, patients might experience orthostatic hypotension, polyuria, headache, a dry cough, or more severe reactions such as angioedema, or hyperkalemia. We would also want to teach our patients how to monitor their blood pressure at home, the importance of compliance with their medication, no over-the-counter drugs such as ibuprofen, which can reduce the effects of an ACE inhibitor, and to avoid increasing potassium in their diet. Nursing considerations. As a nurse, we would want to monitor our patient's blood pressure before and after administration of an ACE inhibitor drug. After, we would monitor for a first dose hypotension effect. This is because we do not want our patient's blood pressure to drop too low. We would also monitor serum potassium levels and would not administer the drug if the potassium levels were greater than 5.5. Monitoring a patient's white blood cell count is also important for the nurse to do because patients on ACE inhibitors are more at risk for neutropenia. Also, patients taking lithium and digoxin also have to be closely monitored because of the increased risk for toxicity from these drugs. Congrats! You've reached the end of our crash course on ACE inhibitors. Here's a list of our references, just in case you need a little bit more further teaching. Thank you and happy studying!